Here it is more than 5.5, so it is slightly acidic. It is less than 5.5, so it is more acidic, type 2. Okay. Okay, fine. Then we have acute kidney injury or acute renal failure. What, see, they might ask, see few questions. Okay, what they can frame is they will be giving you the features, clinical features of acute renal failure. They might ask one feature may not be the acute, one clinical feature may not be the tough acute renal failure. They might ask all of these are features of AKI except. Okay, such questions can be framed. What exactly happens in acute renal failure is there will be sudden increase in the serum creatinine, which will be more than 0.5 from its baseline. Think if it is 0.7 or 0.8 today, suddenly within 2 or 3 days or max 1 week, we see sudden rise of creatinine level. Say it is 0.7 today, next week it will be 1.3, 1.4. Okay, more than that. Just giving you the example. So whenever it will be more than 0.5 from the baseline for a period of days to week, we can think of acute renal failure, also called as acute kidney injury. Along with that, along with increase in the serum creatinine, we have accumulation of nitrogenous waste products. Okay. See, one more points I will be adding here. We have something called as azotemia and uremia. The difference is azotemia, there will be increase in this blood serum creatinine, then BUN, blood urea nitrogen, all those values will be increased. Okay, but patient will be not having any signs and symptoms. That condition is known as azotemia, AZOTEAEMIA. Okay, and uremia is all these blood parameters will be increased, creatinine, blood urea nitrogen, everything will be increased. Along with that, there will be signs and symptoms. That condition is known as uremia. Okay. With the accumulation of nitrogenous waste products, we'll be seeing increase in the serum creatinine level. Okay. There is some criteria called as Rifle criteria for renal failure, acute renal failure based on the GFR, glomerular filtration rate. Even that mnemonic can be thought of a rifle. R is risk when GFR is reduced by 25%. That is a risk. Okay. Whenever the normal GFR per day is 120 ml per minute or 180 liter per day. Okay. Whenever it is reduced by 25%, 25% means whenever it will be 180 means it will be around 150 ml, right? 150 liters, sorry, 150 liter per day. Whenever it is less than 150 liter, it can be called as categorized as risk. Okay, according to Rifle criteria. Injury is whenever GFR is reduced by 50%. Okay, we can call it as a failure when GFR is decreased or reduced by 75%. Okay, you can call it as a loss of that kidney. Whenever this failure, that is, whenever the failure continues for 4 weeks, failure is nothing but reduced in GFR by 75%. Then we have E, the last part of Rifle, E, which stands for end stage renal disease, is nothing but persistent failure for 3 months. Okay, see, you can see here loss is nothing but the failure for 4 weeks. Then end stage we have persistent failure, this reduced GFR by 75% for more than 3 months, we call as end stage renal disease. If it is reduced GFR by 75% for more than 4 weeks, it is loss of the kidney. Okay, loss of the function of that kidney. Okay. Just go and see what are all the signs and symptoms of acute kidney injury. Okay, because it's very important. It will be sudden oliguria will be there. Okay, And then we'll have a sudden increase in the creatinine level. Okay, there might be pain. All these clinical symptoms you should be knowing. Okay. Then causes of CKD. Coming to the CKD, that is chronic kidney disease. The most commonest cause in the world is diabetic mellitus. Most commonest cause in India is diabetic mellitus again. The most commonest genetic cause for chronic kidney is adult polycystic kidney disease. I'll be telling you in the further slides about the polycystic kidney disease, what exactly it is. So it is most commonest genetic cause of chronic kidney disease. Okay, it can be a question. This especially adult polycystic kidney disease is one of the important or most commonest genetic cause of chronic kidney disease or chronic renal failure, whatever we call. Okay. Signs and symptoms or clinical features of, not everything I've covered, but all the important points definitely, which will be helpful for MCQ, I've covered here. Chronic renal failure or chronic kidney disease, the commonest clinical features are half and half nail sign. Okay, what exactly happens here is there will be white proximal and red distal half of the nail bed, usually seen in case of CKD patients. Okay, chronic kidney patients or chronic renal patients. The proximal part of the nail bed will be red, mean white, and the distal part will be red. Okay. Then we have electrolyte abnormalities. See this, interesting. Try to remember this point. There will be increase in potassium ion. Okay, serum potassium will be increased. Why? Because the main function of the one of the main function of the kidney is excretion of potassium, right? Whenever the kidney cannot function properly for a prolonged time, there will definitely be increase in the serum potassium levels. Then increase in the hydrogen ions. It will be acidic. Okay. There will be no acid-base balance in the body because kidney function is reduced. So the blood will be turning towards the acidic nature. Okay. Thereby, there will be increase in the hydrogen ion. Blood urea nitrogen will also be increased. Okay, because it cannot be excreted. The kidneys cannot function normally in CKD patients. Okay, but see this, there will be decrease in the calcium ions. Keep this point. Why there will be decrease? Because there will be no proper function of the kidney. When the kidney cannot properly function, there will be no activation of the vitamin D3. Vitamin D3 is essential for absorption of the calcium ion from the intestine. Only then, only if the calcium is absorbed from the intestine, or if it is converted from the released from the bone, there will be increase in the plasma level of the calcium. But in case of CKD patients, that does not happen. So there will be decrease in the calcium levels. Okay, serum calcium or plasma calcium levels will be reduced. Okay, serum calcium level. Then we can see increase or decrease in the sodium ions and metabolic acidosis. See, these points are important. Okay, increase potassium, increase hydrogen ion, BUN, and decrease in calcium ion. This definitely can be a question there. Okay, all of the following are increased in CKD except answer should be calcium. Okay, the definitive diagnosis of CKD or chronic renal failure can be established on the basis of bilaterally reduced renal size. In case of CKD patients, we always see that there will be decrease in the size of the kidneys in the long term. We have something called as restless leg syndrome, usually seen in uremia. Uremia, I've told, is symptoms along with increase in the parameters of the blood, creatinine, blood urea nitrogen, all those things. Okay.